My name is Noemi Guevara, and it's my pleasure as the Director of Alumni Engagement to welcome you all to this 49er Industry Chat. Before we start, we would like to inform you this session is being recorded and will be available on demand on our website at www.csulb.edu/alumni. We also encourage you to use the Q&A box to submit questions for our guest speaker today. And now I would like to introduce our moderator for the chat, Alice LaViolette. Alice is an alumna earning her degree in psychology in 1969 and a master's degree in 1980. She was recognized as a distinguished alumna in 2011 for the College of Liberal Arts, and she currently serves as a member of the CSULB Alumni Council. Alice, thank you so much for moderating this chat today, and now I pass it on to you.
Oh, thanks a lot, Noemi. And I am very happy, and I think we're very fortunate to have Laurie Sicaeros as our speaker today. Laurie is the Chief Operating Officer of Memorial Medical Care Foundation, where she provides management functions for MemorialCare Medical Groups and the Greater Newport Beach IPA. In 2011, she established the MemorialCare Medical Foundation, which is better known as the MemorialCare Medical Group, and has more than 275 physicians located across 35 locations in Long Beach and Orange County. She's responsible for operations, for strategic goals, and developing strong physician alignment. She holds both a bachelor's degree from Cal State Long Beach and a master's degree from Chapman, both in healthcare administration. And now I'm happy to turn it over to Laurie. Thank you so much.
Thanks, Alice, and good afternoon, everyone. Thank you for having me. Just a little bit of background about myself. I've actually been with MemorialCare for 23 years. It'll be 24 years in April. So you could say I haven't gone very far, right? I've loved MemorialCare, and so I found a home as a data analyst way back when, working at one of the hospitals, and was the type of person who just never said no to things. You know, anybody asked me to do something, absolutely, I want to do that. If new initiative, let's grow, let's purchase a hospital, let's sell a hospital, let's buy a medical group. Of course, this is fun. You don't know how those things are going to end. And so I was always that person that was eager to do that. And you know, it got me to where I am today. If you ask me about my path and how I've gotten here, it's been an interesting path. Like I said, I started off as a data analyst looking at, you know, growth in strategic areas to advance women's healthcare originally at one of our hospitals. And, you know, from there it went, I had IT, I was responsible for bringing Epic, our EMR, and making sure that 2,800 physicians used it. You know, not-for-profit healthcare is interesting in the state of California. You can't pay doctors to do things. And so you feed them a really nice lunch and hope that they train. And then you provide all the support you can so that they will use the EMR. So, you know, evolved from EMR then to physician integration and physician alignment initiatives on the strategic plan. I was then responsible for starting up our 1206L, which is the medical foundation, which is the vehicle in California you can employ physicians. And so it is how we go about exclusively sort of contracting and employing doctors here. And so built that, did 46 other transactions in the past 11 years since we went live with that. It's been an amazing journey. I feel like I've birthed a lot of the initiatives here and I'm very protective of them. It's hard for me to get rid of things. That's why I have these titles that I have. But I love what I do. COVID has been an interesting, you know, time for healthcare for me in particular, but it reinforces the calling, right? I wouldn't want to be anyplace else. I know people locked up at home. I was here every day. How do we get PPE? We were in the port of Long Beach picking up boxes from ships that were coming in from, you know, all over the world to secure the PPE that we needed. So that way the patients and our staff were safe. And, you know, and that's sometimes is a 24/7 job, but I couldn't imagine being anyplace else. So maybe
Laurie,
that gives you a little.
Laurie, can I ask you a question that's come in? What drew you to healthcare? Why healthcare?
So I actually was a pre-dental major. So I was a biology major when I first started college, and I was going to be an orthodontist. My uncle was an orthodontist. That's what I was going to do. Worked in his practice during summers and holidays and that sort of thing. And he got sued and by one of the patients, and it freaked me out. It completely, so I went from wanting to be an orthodontist to now I'm going to be a lawyer so I could protect people. And then as I got into my first law class at Long Beach, I basically said, no, I'm going to be in administration. I'm going to help the providers. I'm going to help the physicians get what they need, so that way, they're servicing the patients and they've got the support that they need. So that was the turning point for me.
Thanks, Laurie. And I have another question too. This is someone who said, I've been thinking about healthcare since COVID hit. What qualities do you think are necessary to be successful in the healthcare field?
Honestly, you just need to care. You have to have compassion, and you need to be here for all the right reasons. I'm in not-for-profit healthcare, so it's not a place you go to make a lot of money. You'd rather work hard and see the benefits of the community and the population that you're serving. So I would just, if you're interested in healthcare, I was an analyst. I started off as an analyst. It was my foot in the door, and I got a lot of exposure because we did a lot of cool things. I never said no to things. I was very passionate about what we did. I also didn't have kids back then, so it was easier to, burn the midnight oil. But I would just say, if you're interested in healthcare, it is a calling, and you will know pretty quickly if this is the place for you or if it's not. And most people, stay for the rest of their lives in some sort of healthcare setting when they start.
Thank you.
Sure.
So can you go on talking kind of about what it is you do sort of day to day, and how you interact with the physicians?
Sure.
To pull them together.
Yep. So on a daily basis, as we said, the Medical Foundation. So the Medical Foundation, like I said, is that weird structure in California. So we have a medical group, which are employed physicians. We have about 300 employed providers. Then we've got the IPA. We've got a couple hundred more primary care physicians. We have a wraparound specialty network of about 1,700 physicians. And then we have joint ventures. So we have a joint venture with a surgery center, SCA, which we have 10 of those around the region. We have Fresenius, which is a dialysis company. We're a minority joint venture owner in that. And then RadNet, and we are, which is an imaging company. We have about 34 locations around the region in that. And we just closed a deal last month on, oh my gosh. PRN is the name of the company, physical therapy, at a physical therapy company in Ahmed. And so on a daily basis, especially since COVID hit, it's about, being able to load balance your patients and their needs and what they need to get to see the provider, and the vehicle to get them there. Do they have to be in person because we can't have offices full? Can they do it via Zoom? Can it be a virtual health interaction? And then, looking at visit volumes. I mean, we've lost a lot of money during COVID, but we're extremely conservative company. So we've persevered. We are giving our employees a 3% increase this year. I mean, we are a family, and we're all in this together. So from a daily basis, it's putting out fires. I had a 7 a.m. meeting with our JOC, which is the executive committee doctors of the medical group, and us. We meet from 7 to 10 once a month, and we go through every single sort of little operational, whether it's, I'm closed practice and I'm getting new patients on my schedule, to, we want to reevaluate our PSA, which is the document between the physicians, and the foundation, and how they get paid. So it could be anything. That's what I love about it, because I don't come into an office every day and sit and do emails. I mean, there's plenty of email, but it's different, and that's the part I love most.
Thanks, Laurie. I have a couple of other questions that came up. What is a typical duty in your COO role versus your physician integration role?
The physician integration role is the one I've had for 20 some years. So that is my love. That is making sure that the physicians have what they need to do what they want to do, right? So if we're going to be doing, robotic surgeries, do they have the supplies? Do they have the equipment? Do they have the initiative? Do they have, and is it something we need to provide at each of our facilities, or can we have a regional approach and provide it here and everybody directs inward? And we have a strategic planning retreat with our boards next week. And that's where we'll sit there for 3 days and go through what are our initiatives, what do we need to do, what are we not doing, or what do we need to do better, especially when it comes to our physicians. We have a saying, no physician left behind, and there's a physician at the table every single decision we make. We're not assuming we know exactly what they need. A day in the life of the physician, they need to tell us, and I'm very passionate about that. As the COO role, it's more of the nitty gritty, dealing with employee issues, dealing with, budgets and, volumes and, supplies, like I said, opening new sites. When we first got into this, we had 8 locations, and we're growing locations every day. We have a new build site that's coming up in Los Alamitos next year. And most of the things that we've done lately, it seems we haven't. Real estate is drive strategy sometimes, and you can't find the location you want, so you have to build something. And so we've gotten into the real estate business. But the real estate business has been interesting because we've turned them into joint ventures with our physicians and given them retirement strategies and investment opportunities into the buildings we built. So.
Wow.
Yeah.
That's amazing. I have other questions for you.
Sure.
Does it, this question is around your education, that you earned a master's degree, and would that be required to move up in the field?
No, in the beginning, I would say absolutely. I was intimidated. I was going to dental school, and then when that didn't happen, it was like I immediately went into grad school because I wasn't done. I didn't feel like I was done. But I also was intimidated by the fact I'm working with physicians with advanced degrees and, these very high level professionals. And I felt like I needed that for me, so I could feel like I'm on a better playing field. But it's not necessary. It's, a bachelor's degree is absolutely necessary. It will limit you in healthcare if you don't have that. There are definitely positions around that you don't need that. But if you want to advance and you want to get into leadership, we have had CNOs, chief nursing officers, who haven't had their 4-year degrees, and we have made them go back to get that, to have those positions, to hold the position. So.
Thank you, Laurie. And this question is, since healthcare administration is a broad field with different paths, how could someone who is interested in healthcare administration get started in learning what is best for them?
I think it's an interesting question, especially what you like to do. I mean, I got in as a data analyst because I was very technical. I liked the detail, liked to understand, how things happen and why they happen, trends, all of those details. A lot of people come in now on the IT side. They're almost engineering examples, and they come in on the IT side, and then they move up in leadership and they come over to operations, because it's all about getting information at the bedside or getting information at the point of care, wherever that point of care is being delivered. And then there's finance. Finance is a big place too. It's very interesting, when you bring somebody in and they've done an internship at Deloitte or something like that, and then they come and take a position here. And not-for-profit healthcare is very different in how we count days cash on hand and how we count things, and how we accrue for things. It's very different than a cash basis type of organization. So those are the sort of, I would say, the big entry points into, and then you get exposure. So if you're not a technical person and that's not for you, then I wouldn't go into the analyst or the data side. You might go into, the support side. You might start with the operations and the support and, work your way up.
And an attachment to that question, or sort of a follow-up, is what majors would best prepare this person for working in the healthcare field? What are the best majors?
I can only speak about myself. I loved healthcare administration. For me, it was super easy because I had 3 years of biology behind me, and I was lab science, and I was going down, what is this? And you have to, dissect it, that kind of thing. And then to go into healthcare administration, it was fun. I loved it. It was, you've got the finance side, you got the law side, you got, all of the exposure that you needed to the different components. I remember Dr. Tumulty at Long Beach. He was my professor for econ and finance. And he was like, you need to go into the finance side of things. And I was like, I don't know, spreadsheets all day long. I don't know that I can, I could live with that, and, debits and credits and all of that. But I loved healthcare administration because it's so broad and you get a lot of exposure. But we have plenty of people who come in for, the information sciences. We have the finance, the CPA side. We've got the psychology. I've got quite a few CTSs, which are the people who are out supporting the doctors every day, who are psychology degrees. And, they're really good at, dealing with all the different personalities and, getting people to do what you need them to do from their perspective.
Well, you're getting bombarded with questions, so I'm just going to keep, is that okay, Laurie, or do you have some things that you want to? Okay.
No, go ahead.
Okay. This question is about, how did you transition from being a student to working in your field? What was that transition like to the work environment?
That was really hard, because when you grow up thinking you're going to be a dentist or an orthodontist your whole life, and then you get done and I had an internship, fortunately, and my internship was actually providing insurance and insuring new health centers for Hoag. And that was an interesting project or internship through Long Beach that I had, and got some exposure there that introduced me to some people. And I got some interviews out of that. And then I just started, working, first started credentialing nurses. Utilization review nurses was my very, very first job outside of graduating from Long Beach. And then from there, knew that I just wanted to be on the provider side, and so went into the hospital, like I said, as an analyst. From the analyst position, I went to what we have an organization for physicians called the Physician Society. And it's sort of our quality, if you're familiar with IHI, which is a national organization to err is human and how are we going to, eliminate mistakes. We have an organization that our physicians lead. There's a board. They have their own responsibilities, but they are accountable for all the quality across the organization and holding the physicians accountable. And so I was responsible for starting that up. And I came into that, and it was like, how do we grow it? How do you get the physicians to do a better job on quality measures and, not make mistakes? And again, we can't pay them because, we're in California. And then that was the introduction of managed care. So that was, the early 90s, and managed care was coming in, and they were taking all the money, and we didn't have money. The doctors didn't have money, and there was no patients in the bed. So, we came together with the doctors and administration and basically found our way to, here's how we work together as a quality organization. Here's what we can do. Here's what they need to do. And they're the ones that develop the guidelines and the pathways for us. So I don't know if that helps, but it's a long way to that answer.
That's and the other question, which you've answered to some degree, but how did you learn the business operations side? And did you have someone that mentored you or that you could shadow?
I was fortunate to always have bosses, leaders that I admired. I was always passionate about how they got how they led, I'm what you call a servant leader. I'm not going to ask you to do something that I wouldn't do myself. I deliver PPE, I deliver lunch, whatever it is I can do to help. I would never, that's how I am. And I've always worked for people that were like that. I've also always worked for people who have balanced life well. I don't do that well, but they always did that well. And I always admired that. My first boss when I came here had 6 kids. And yet she seemed to work all the time and make every soccer game that her kid was in, and how she did that I admired that and have tried to emulate that and, be sort of that well-rounded person. But there's been several people within the organization. Annette Walker, who's now the president of City of Hope for Orange County, she hired me when I came to MemorialCare. Tammy Brailsford, who's recently left the organization, but I've, reported to her for like the past 14 years, and strong, just had a voice. I've always worked for people who didn't take credit for your work. They always promoted the work that I did and gave me credit for it. So I think that's an important thing that I've learned along the way, and like to give those people the credit that they deserve for the work that they've done.
Yeah, that's collaborative leadership, which is really important, and the up and coming kind of leadership. How do you stay current on trends, policy, technology, et cetera, in healthcare? And what, you can answer that. This is a 3-part, so that was pretty, yeah.
So staying current, especially during COVID, and literally within a week, we were doing virtual health. We were doing on-demand urgent care visits. And it's just a matter of surrounding yourself with really smart people who know that. We hired a director of virtual health, and Anne knew everything that there was to know about that, and was basically, we just cut her loose. And what is it you need? We have, really smart Epic people. And then we have Kristen Pugh. Kristen Pugh is our vice president of advocacy. So she is the one that's always in DC or Sacramento, sort of advocating for MemorialCare, or the things that, we want to see and we think are advantageous to taking care of the communities. And she's the expert. I had one of the physicians reached out to me on Monday and said, I hear CARES Act is going into phase 3. What does that mean? Are they going to release more dollars? This kind of thing. And immediately connected him with Kristen, because Kristen's going to have the most recent information. So there's a lot, and it's hard to keep up. But as you navigate, you pick up the things that you need to know and your teams need to know, or you make a call and you get the information from someone.
Because telehealth is very prominent now, do you expect new hires in the field to have some background on the technology side? Absolutely.
We just approved a position on Tuesday. So yes, absolutely. We need to grow our bench strength really in that area. We have a few, but we need far more, because I don't think it's going away. And the things that we can do right now, sort of on the primary care side, but there's a whole bunch of specialty on-demand consults that we can do with the specialists, which actually speeds up care, because you're not waiting, in line for 3 weeks to get an appointment with a cardiologist. You can get those answers right away and advance your care. So absolutely, yes.
And just in terms of beginning, this question is for soon-to-be healthcare administration graduates. What advice would you give to us about trying to get started in new entry-level jobs? And because you began as a data analyst, many of us began with roles such as patient service reps and administrative assistants. Is this a good place to start? In other words, where is a good place to start?
Absolutely. Administrative assistants don't stay administrative assistants very long if they're good, right? Because they have a lot of exposure to a lot of people and they get picked off very quickly. So that's always a good area. The patient care side of it is interesting too, because that's a different side of operations. I would say, do you want ambulatory or do you want inpatient? And because they're very different worlds, and that's a good. And then like I said, we have CTSs. We have this clinical training specialist role. That's a little bit of you're helping the providers care for the patients through the technology that we have. And so they're either a psychologist or a technical expert. We have one that just is an engineer. It's a variety of different things, but together there's about 30 of them. Together they are far more superior than they are individually because of the bench strength and the talent that they have behind them. So I would just say, get your foot in the door and say yes to things, be that person that is eager and wants to do more. And the more you do, the more exposure you get, and you will get picked off. The CTS is a huge area. We lose them all the time, but to other areas. We had one that recently is now the director of the OR at one of the hospitals. So.
Well, how do you think the industry will change over the next 10 years for new leaders?
It's a great question. I think a lot of it getting like this, we're doing this virtually. We're not sitting in a room. Somebody who's very comfortable with the virtual work, our CFO, she comes in on Wednesdays only now. She's only here on Wednesdays, and she does the bulk of her job from home remotely. And, and she's a workhorse and she gets everything done. I'm old school, and I feel like I can do a better job if I'm here in the office. So I think there's a combination of, how can you lead and how can you encourage and, energize teams through this medium. I think that's a talent I haven't learned yet, but I sure want to, and do my best to keep the teams. I still get in the car and drive down and different sites and, take cookies and all that kind of stuff just to see the faces and, and to thank them for, all that they're doing every day, because it's not easy.
So you said that you had role models who had a good work-life balance and that wasn't your strong suit. But this question is that you seem amazingly positive. So how do you keep that attitude? How do you keep your enthusiasm up high, your enthusiasm level? I
just love what I do. I'm excited about everything that comes our way. And it's, to me, it's not a challenge. It's the opportunity, that it brings. Okay, we're at an inflection point. Where are we going to go? What are we going to do? And I just love that. I love making a difference. I love the fact that, we are an organization that we leave money on the table every day. We would prefer you to get your imaging studies done at a place close to your home and in the community, rather than schlepping you to the hospital. You have to pay to park. It's, navigation's not easy, but we'll make 5 times more money if you do that. We don't do that. And we are one of the only organizations around who hasn't done that. We know that the health plans are going to be dictating, where surgeries can happen. They have to happen in the surgery center, or they're going to happen in the hospital. So we bought surgery centers. So we are ahead of that. And every time we get ahead of that, we leave money on the table. But we're also the only organization around that Blue Cross has said, you guys need to do an imaging study, you do it. You just figure out where you need to go, because they know that we are doing it at the lowest cost of care. And it's the same physician reading, whether you're in the hospital or you're in that imaging center. So I like the fact that we're in it for all the right reasons. This organization stands behind, if we make a decision, that's what we're doing. And it's not because it's going to make us more money. It's because it's the right thing to do for the patient. And again, the total cost of care, because healthcare is insane when it comes to the finances.
So it sounds like your job is your hobby, and it doesn't feel like work because it's so much fun.
That's true. Sometimes the people and the politics are what I may go home and have a glass of wine, but yeah.
This question is, how long did you go after you got your bachelor's degree? Was there a period of time between that and when you got your master's? And how long was that?
6 months. Yeah, because I was going to dental school. My father passed away during that time, actually. I got a deferment to dental school, and in that period of time, I just enrolled at Chapman, and because they would let me do the healthcare administration program in a year, and so I did it very quickly.
Okay, what's something in healthcare that you haven't done yet that you would love to do, that you would look forward to doing?
That's a great question. I don't know. Wow. I don't know. I sometimes I wish I was more clinical, if I had, a nursing degree, or if I had some more clinical, I mean, you pick it up along the way, but at the end of the day, I'm not a clinician. I think I could be more helpful sometimes if I had that, but gosh, that's a tough one. I don't know. Great question.
Do you do continuing education?
So I do. I actually do. We provide continuing education for our physicians and our providers, whether it's a allied health professional or it's an actual physician, primary care or surgeon, and I do it with them because I like it. So that's the kind of continuing education I do. We have a leadership academy here. I'm the dean of the leadership academy. So I go through every year with a group of half physicians and half leaders within the organization and bring them through sort of an MBA program of MemorialCare. So I feel like I get my continuing education from being the dean of that group.
And someone asked, how do you specifically handle a work-life balance as a working mother?
Well, my son is a freshman in college, so I'm kind of I have less guilt now this year than I had last year. Technology has helped because I can do more at home. I can do more from home. I went to see him. I hadn't seen him since he left in August for college. And I went and saw him last weekend, and I can take my computer with me. And I was there on Monday, but I was still Zooming and logging in. And so, it's just, that's how I balance it. I don't not do things. I try to do everything and just balance where I need to be and when I need to be there.
And this question is, would you recommend a master's degree in business or a master's degree in healthcare administration?
For what I do and for my staff, my employees, my executives, I don't think it matters. I think whatever you like best. I fell in love with healthcare administration. I thought it was easy. Like I said, I got my master's in a year. It was super easy for me. But if the MBA is more your cup of tea, and it doesn't matter on my end. I would hire either one.
And this question is, even though you surround yourself with experts, how challenging is it to work directly with physicians? And how do you learn to speak their language? Because that seems like an art in and of itself.
It is. They're the expert in the room, and you just remember that, whether they are or not, right? They are the expert in the room, and you suggest things, bring up ideas, that kind of thing. And if it's their idea because they glom onto it, let them own it. You need the ownership along the way anyways. But that's been, it's more of what's the perception and we have different medical staffs, right, at each of our hospitals. And each one of those, we need to make the same decision because we need some standardization. And so you have to know their personalities, their culture at that particular place. And then how do you get them to say yes to what you need them to do? Sometimes it's a little pre-lobbying, it's having those relationships. It's more about the relationship and knowing that their kid's a freshman in college, and their wife works here, and they adopted a dog, that kind of thing, and just having those relationships so that way when you need something, you can get that done.
And what's something you wish you knew earlier in your career?
Well, I'm the one that never had a plan. I was going to be an orthodontist, and then, I didn't know what I wanted to do. And so anytime somebody said something, I said yes. I think if I would have had a plan, I would have limited myself. If I would have said, oh, I want to be a director of, technology or, information systems, I would have limited myself. But I wish I would have been more confident in what I was doing, and because the passion, there's still a little bit of, insecurity there, that I wouldn't always put myself out there. And I wish I would have put myself out there a little bit more. I could have been one of those, rock star executives at 40.
This is for those that might be in between employment right now, but interested in entering the healthcare industry. What recommendations or advice do you have for them during this time when opportunities might be limited, or are opportunities limited?
Well, we're always hiring, and I would say that those positions that have opened up during COVID have been a result of virtual health technology and new needs as a result of what's happening in the community. But also we've had people move. We've had people that have left the state, their spouse or their partner has the ability to work from home. If they live in a different state, they don't have to work anymore, that kind of thing. And so we continue to hire, and there's always positions that are available. I would also say though, that if you haven't found anything that you like, then, reach out for volunteer opportunities, internship opportunities, and make connections that way. If you have the time and, you're open to like $12 an hour or whatever the internship pay is, we've had quite a few come through like that, and, that gets their foot in the door, they get some exposure. And when something opens up, then it's not posted, they slide right into it.
So is Memorial hiring interns right now?
So we always there's always somebody around that's hiring for internships. It just depends on, what you're looking, to do. If you're looking for a business development opportunity, you're looking for marketing, just depends on the area, that you're looking for. But there's always somewhere of our 12,000 people who are looking for that.
Where do you go to find those opportunities? Is there a website or?
You can go to the memorialcare.org website, and you can look for career opportunities, and everything is listed there. You can send an email to HR. There's a contact us email there. You can reach out and say, I'm looking for an internship opportunity, and they will know of, executives and route your email appropriately to meet the best match.
Okay, and I want to ask you something. What for you are the most difficult situations that you have to handle?
Politics. Navigating
more specific.
So I will go to, I don't want to go to a current day example. I will go to an example that happened. So when we brought one of our hospitals live on Epic, so literally it happens overnight. We have a command center, and you live there. You live there for at least a week, and your support. We had a physician who came into that command center hot. He was yelling, he was throwing things, he was just beside himself, and that's the kind of, you're at first, you're like, all right, okay. And then, went over and sort of took him by the elbow and got him out of the room so he'd stop throwing things. And then just listened, half the time it's just listening, right? And finding out what is the real issue, and then, being able to address the issue. And he came in the next day and apologized to everybody in the room, brought them pizza, that kind of thing. But I would say that, escalating high, sort of emotional situations it's a talent. It's something that you learn over time. My first experience with that, there is no way I would have run, get me out of the room. But you just learn over time. My first real negative experience was we were doing at one of our hospitals, we were expanding our CCS, sort of Medi-Cal for pregnant moms. And we had them in the hospital, we could sign them up, we could enroll them, give them tours, transportation, all of that. We had contracted with an outside transportation company. They were pretty flaky and pretty expensive. So the CFO said, I think we should just buy a couple vans and we should do this internally. So I did that and then hired the drivers and made sure that one of them was drinking and crashed the van. Fortunately, he didn't have any pregnant moms in the van because he was responsible to getting them to and from their appointments. But that was one of those things where, you're sort of deer in the headlights at first. You think about it and then you act on it. And that was the first person I ever fired. And it was just like, you get to the point where like, you are not taking down my program, but it was scary. I was scared to death. I didn't sleep the night before, you play these things in your mind. And now, it's just, 23 years later, you've got the experience and it's not so challenging. But I would say for me today, the most difficult thing that I have to deal with is really, we've got CEOs, COOs, and, and it's just everybody has what they need to get done. And sometimes they clash, right? We have ambulatory surgery centers. We have hospitals that need patients for surgery, right? And so then they'll come to me and say, how could you send the patient over here when I have a bed over here? Well, the health plan says, that kind of thing. But those are my most challenging situations today. I know, very long answer. Sorry about that.
No, it's a very good answer. It's a very thorough answer, and it was good to hear. I think a lot of people go into fields and certainly aren't anticipating the kinds of things that you're talking about. I think we have time for at least one more question. This is for a foreign master's student with purely clinical background. What is the first step in preparing to take advantage of the potential increased demand of telehealth professionals? What technology skills should be garnered?
It's a really good question. I have people that could answer that. I think understanding how the technology works and how things integrate together. We have the Epic EMR, and so what are the easiest things that can plug into that? And understanding those technologies and how they can talk to each other, because if you have separate systems, the physicians will never use that, right? The office staff, if you have to schedule over here and reschedule over here because Zoom isn't talking to this system, it'll never work. So I would say understanding how things plug into each other and you can further the integration, the better the technology and the better the use will be.
Okay, are there, let's see, we have, what skills and experiences might now be a requirement in order to be successful in healthcare administration?
Experience. Get in the door and just start working. Just start getting the experience. It's so hard to come in without any experience and just leap right into leadership roles. We have had people that have climbed very, very fast, but just getting in the door, getting the education. And if you can, I don't know if Long Beach still does it, but when I had to do an internship. That helped me tremendously in my first job because it connected me to people that I met during my internship. And so I just think, get in the door and get the experience. Healthcare is interesting that way. It's hard to not have the experience. I feel bad for nurses in particular, and that's why we have a great relationship at Long Beach with Long Beach State, because we've got a nursing program, right? They train here and then they go to Long Beach Memorial and they do their rotations and all of that. So they come out with experience. It's really hard to hire people that don't have experience. So.
Okay, here's one more question. How does your work affect the clinical side coming from a business side in healthcare?
Yeah, it's a dance. And like I said, they're the experts, the clinicians. I go to them. When I started, I had a physician down in San Juan Capistrano who I met with, and he said, nobody's ever come down here to meet with me. It's like, that's where the patients are. That's where the revenue's generated. Why would you sit on the freeway to see me? I'm going to come to you. The action's there, and I respect that, right? I support that. I'm here to make it easier so that they're not having to do the administrative stuff. They can do more on the clinical side, make those decisions, care for the patients, and I try to knock down the barriers that they have in their way.
Are there any final thoughts or observations or recommendations that you would like to pass on to everybody that's listening on this chat?
I think I've said it several times. Keep your mind open, say yes to things. I think in any industry, that's a good recommendation. People will, glom onto you. They like, it's not how much you're going to pay me. It's, what's the opportunity going to bring me? And I would just say that, I love MemorialCare. If you're interested in MemorialCare, come here too.
Thank you so much, Laurie. This has been not only very informative, but it's been inspirational. So thank you very much.
Thank you. My pleasure.
Wonderful. Well, thank you, Laurie and Alice, for a great chat today. Very informational and a lot to think of for our current students on this call today. Before we go, Laurie, are you on LinkedIn where we could possibly connect with you?
I am on LinkedIn. That is the only thing I'm on.
I was going to ask Laurie if she had a phone number, because I do an anger management group and I work a lot on de-escalating rage and anger. So when you said that, I thought maybe we should talk.
Great. Well, thank you everyone for joining us today. If you are interested in learning about future programs for alumni, please follow us on social media at CSULB Alumni. And thank you so much for joining us. Have a great day.